Perfect. Great. Okay. Well, let's get started, Melissa. Hi, everyone. My name is Laura Fleischfresser. Alongside me today is Melissa Harward. She is our Director of Customer Success here at Gratia. I am co-founder and VP of Clinical Affairs, and we are so excited to be sharing with you our third part of our summer webinar series, Leveling Up Workforce Motivation. Today, we're focused on elevating quality care. And quality care goes beyond just adherence to protocols. It's really about creating an environment where teams feel motivated and go above and beyond. And so, Melissa and I are excited to share the work at some of the hospitals that we've been partnering with and how they have successfully used Gratia to enhance care quality, patient experience through some of the innovative games that we deliver, all within a short period of time, just in a few weeks, low budget, but really driving big results. So let's jump in. Okay, great. Okay. So, for anyone who may not be familiar with who we are, Gratia Health, we are a workforce optimization platform. That's the technology that we deliver. The platform is designed specifically to work for the frontline teams and frontline leaders. So, over the past 2.5 years, we've been partnering with national organizations such as Scion Health and LifePoint Health across over 85 plus hospitals, impacting over 7,500 clinicians. This collaboration with these two healthcare organizations have really led to significant improvements in both patient care, team morale, across all of the facilities that we've been partnering with. So we're really excited because Gratia really is something different. It is what truly sets us apart from other platforms is our comprehensive approach to recognition and delivering excellent care and quality. We're not just a traditional recognition platform. Instead, we deploy fun, rewarding incentives with proven gamification principles and provide real-time feedback to leaders and to the organizations that we partner with. So this approach allows us to drive measurable behavior change among frontline teams and results in really substantial impacts on hospital performance metrics, which we'll show you here. Okay, so today we are focused on care quality. Like I said, we've explored in our previous webinars some of the key behaviors that when you recognize them, you can transform those everyday activities that frontline teams do really into extraordinary outcomes. And these outcomes all align with strategic priorities across the hospital organizations that we're partnering with and contribute also to building a stronger and a better culture of excellence. So today we're excited to share about how we've turned behaviors around delivering a better patient experience and following best practices and standard care protocols to then influence and improve patient satisfaction, improve quality indicators, and again, do this all with minimal effort from frontline supervisors and managers, and that are driven by the frontline teams themselves.
We're putting a game on it. It's exciting.
Yeah, we're putting a game on it. I love it. Oh, okay. So let me go here to our next slide. Okay. We know that care quality and patient experience is a constant priority for hospitals, especially the hospitals that we've been partnering with, and definitely a challenge that is impacted across the entire hospital, and definitely one that many frontline leaders and teams encounter. So the pressure to improve patient experience scores, HCAP scores, can be immense for many frontline teams. While the majority of hospitals have initiatives to impact patient experience, a lot of the evidence and research that we found is that only 2% of nurses actually receive real-time patient feedback. So the feedback may be coming in, but how often is it getting actually to the frontline nurses? Not very, very often. So this gap complicates their ability to improve and deliver better care. Also, leaders are oftentimes flying blind and are operating without critical insights. Feedback may be arriving late after a patient is discharged. Again, furthering the disconnect between the actual behavior and action that the teams are taking to the outcomes, and then delay in any necessary adjustments that need to be made. And burnout. So, I hate to keep putting this as a challenge and talking about this, but it remains high and remains a significant concern, especially at the hospitals that Melissa and I partner with. We continually hear how nurses are exhausted. They're reporting burnout. 50% of nurses report emotional exhaustion. 40% of nurses in the research continue to show that, they're missing critical care steps due to fatigue or, just a heavy workload. So all of this isn't going to be solved by, hey, let's do more protocols, or let's email our teams and do more in-services around protocols. That often fails to stick. And so we really want to take a new approach to getting in front of these issues and challenges with the frontline teams. Okay. Oh, sorry here, got out of it. Okay, so with that said, recognizing these challenges, our goal here at Gratia is really to empower the frontline teams. We really want to have our nurses, CNAs, respiratory, all of the frontline clinical care teams take ownership of their engagement and experience when delivering quality care and delivering a really great patient experience. And that what we've seen, and we'll show you here with some of our Gratia games, is that this change really does happen when nurses are feeling valued, they feel recognized for the contributions and for the actions that they take. Our games deliver real-time recognition that can spark that intrinsic motivation. We've talked about that before in other webinars, really foster and sustain daily engagement. And this helps nurses to understand and see that, hey, my actions that I took today really do matter, not only for my patients, but also matter to my management. So by reinforcing the actions that align with a hospital unit or a hospital's broader strategic goals, Gratia can really effectively drive behavior change. And we'll show you that here. So when change is consistent, when it's visible, meaningful, that's when the results are achieved. Hospitals that are using Gratia and that have deployed Gratia games and recognition approaches see tangible results, lower turnover rates, higher or less agency spending, improve patient experience scores, and have been able to do that in a relatively quick manner. So we're not only supporting the progress and the procedures, but really helping to accelerate and deliver ROI on those measurable outcomes. Okay. So let's dive in, Melissa, to two games that, as I mentioned, are focused on care quality and the patient experience. So the first one is the Care IQ game. And this is a game that is really designed to boost engagement and awareness around care practices, really to help team members stay focused on priority care practices and drive awareness. So, we have an example here, but I can turn it over to you if you want to kind of walk through an example, and we can also show everyone what this looks like in our Gratia app real time.
Yeah, of course. Thanks, Laura. And as you mentioned before, this is all about empowering the frontline staff. So that's where we start, especially with a game like Care IQ. This actually developed because of the facilities who were starting to see their quality indicators either ticking in the wrong direction or wanted to make sure that these clinical best practices were kind of top of mind, outside of that in-service time for their team. So we try to make it really fun here. The Care IQ game is all about engaging those frontline staff members to actually drip in a couple of smart shouts. Smart shouts are really fast, fun knowledge tips around particular care quality indicators, whether that's looking at reducing your Foley catheter infections or improving your central line utilization rates, your wean rates. It can be about really any content, and we've built some modules around those quality indicators that for those facilities where we're targeting those specific changes we can deploy and make this really fun and engaging for the team. So the example here, right, Jen, who's coming onto the Gratia experience, she sees one of our smart shouts, right? Her team is looking at central line utilization this month. That is the focus and the theme. And so she's going to see those smart shouts, and then we're going to encourage her at the end of the week to complete a really fun, what we call brain bursts. So they're really quick, fun knowledge checks around those clinical best practices during the week that Jen is seeing. Jen receives a text message anytime we're posting these. So we're a mobile friendly and really mobile forward engagement app where she logs in with their phone number. She gets to go to her shout outs feed to see these hot tips and to play the game. So we run everything through shout outs, which is our main social feed for the team. And so at the end of the week, she's got an opportunity just by answering a couple of questions to be entered into our point raffle and win some points. She can turn those points into something like a curated gift card or even use those for a pay differential later down the line. Her supervisor is then able to see, oh, hey, Jen completed this quiz, right? There's a whole feedback loop that we've built with the supervisor staff where they can see who is engaging with this content, who has this top of mind, and what do we need to focus on maybe for the next month. So really fun kind of packages that we're putting out for the Care IQ game. I'll show a brief view of kind of what this looks like for Jen in real time. So I'm going to share my screen. Excellent. So this is an example of the shoutouts feed. So as you're going through the feed, you'll see, oh, hey, this targeted content for the Care IQ game, this one happens to be about Foley's this month, was deployed for those CNAs. So the CNAs are seeing their specific tips and keeping those top of mind, and then they get their whole other set of the brain burst content at the end of the week to play. This facility actually did a great job this week. They unlocked the raffle. So to unlock the raffle, the game we play is we want at least 50% of the team to engage, right? Play with us and you can win. And so that brain burst raffle, we're going to announce that they get pushed out for every user that's relevant for them, whether they're an RN or an RT or a CNA or a combination thereof. And they can take that brain burst right there in their shout outs feed. So, really targeted content. We're also able to see and track. Hey, if you haven't engaged with this, let's put it back in front of you. So it creates a really great feedback mechanism for the site leaders as well as those users who are engaging with the brain burst. One of the things that we'll talk about in terms of the results, which I think is probably the most powerful result of this game, is that 92% of the team said that they were able to recall, or 82% of the team rather, said they were able to recall one of those clinical best practices in real time. So keeping that as they're walking into the patient's room, as they're providing that great quality care, keeping these knowledge tips top of mind means that they are more than likely able to replicate that great quality care. We see an increase in the RN satisfaction and engagement, right? We're reaching more than half of the population, kind of that targeted audience for the Care IQ game. And we're including details around these quality indicators that bring them more to light for the frontline care team. Sometimes it can be a little bit distant in terms of what I'm doing with a patient in the day to day. How does that actually impact the facility? How does that impact, what's top of mind for our site leaders? This actually ties it back together. So it makes it more real for those frontline caregivers to remember, hey, when I'm walking in that room, what I'm doing for that patient really matters.
That's
Yeah,
great. That's amazing.
it's
Melissa,
been really great.
what if, I know we hear a lot when we're on site, it's hard to stay in front of or know, hey, this person has attended an in-service or this person,
All the tracking, yep, and
yes,
the follow up.
received that email. How can Gratia help, make sure that, hey, who's seeing the information that needs to see it?
Yeah, absolutely. So we keep a really close pulse on who is engaging with that targeted content. So we can tell you as a site leader, for example, hey, so and so, they might need a little bit of help. We're going to retarget this content. So if they didn't see it the first time, it's really easy for us to get that back in front of them and to keep that top of mind, right? You're not tracking somebody down, you're not having somebody sign in or sign a sheet to make sure they're attesting to seeing this content. We can actually tell, hey, who's paying attention and maybe who needs a little bit more support there.
I love that. That's my
Yeah.
favorite part of this is just the hands off that as a manager you don't need to be tracking so closely, but Gracia gives me those insights to say, oh, this person or this cohort of team members saw it. This cohort is going to be retargeted, and I don't have to do that.
Yep,
Um,
and that feedback loop is happening automatically. So if you're a site leader, you're getting an admin digest of who's playing the game, who's engaging, who's won points, who are your top players every week. So it's really helpful as you're thinking about going out into the team and checking in. You have that information there at your fingertips as well to help drive those conversations, especially if y'all are focused on a particular quality indicator that month or for the quarter.
I love that.
Yeah.
Perfect. Well, and the results and of why it works are here. And so exactly over half of the eligible staff are engaging and seeing it. As you mentioned, better recall and applying those tips in real time when delivering care. And so that's great. So when we're seeing that shift in frontline behaviors, it doesn't take a big reward budget to do that and be able to see those measurable impacts. It's
Yeah,
amazing.
it makes it a lot of fun. If you're completing the brain burst, you're getting a raffle ticket, which means that the cost can stay relatively low, but it makes a really big impact for the team. And that 86% of folks saying that they were able to recall a smart shout in real time is huge impact, right? You want that to be happening when they're walking in and providing that great quality care.
That's great. And one thing I think that when this slide was created at the time, one hospital that is implemented this saw a 12% improvement in their quality indicators. So
It's
in that,
huge, makes a
those,
difference.
yeah, in those nurse sensitive quality indicators. So that's amazing. Thanks. Okay, let's look at the next one. This one, Compliment Circle, is a game that takes patient and peer compliments and transforms into stronger team morale. And as we talked about, that real-time recognition from your patients and their families. So this one is, I'll turn it over to you, Melissa, to talk through this one.
Yeah, this is probably my favorite game that we play. So, what we heard from site leaders when we were developing these games is that, hey, I want to recognize my people, and we're talking about that in my leadership huddles, but that's never getting back to their frontline staff, right? And there's so much good news and recognition to share. Shout outs through Gratia allows that to become the channel where that real-time feedback is shared, not just with that particular frontline caregiver, but the whole team potentially, right? So everybody can see who's doing a great job and who's been recognized. So the compliment circle, the way it works is that in every patient room, and I've got an example here, we've got a quick flyer, and we're encouraging you as a peer coworker, so a nurse to nurse, you know, across the team can give a compliment. A patient themselves can get a compliment just simply by scanning that QR code on their phone or their family member. And we get a lot of family members who utilize this to recognize their family's care team. And it makes a huge difference. So, for example, right, as someone is completing that QR code, we're asking them, one, keep it positive. Okay? What's a small moment that made the difference for you as a patient or a family member today? And we're capturing so many great stories that then immediately get fed back to that caregiver and the rest of the team. So if that compliment is submitted with the QR code, really quick and easy, we're posting it in shout outs. And so that team member is tagged in the post. They're able to see a text notification in real time saying, hey, so and so, you got a great compliment. Hey, Betty, look what this patient had to say for your care. And that feedback loop, I think, has been incredibly powerful for the team. The majority of the team members feel like this makes a difference when they're walking into the patient's room on the actual level of quality care. When it's top of mind, this is why probably everybody got into this profession in the first place, right? It's all about the patients, and hearing those compliments directly from patients, their family members, or even your coworkers makes a huge difference. The way it works within Gratia, again, you get that text message in real time and you can see that compliment. You're tagged in it. You might win some points if you have the most compliments. You can even earn badges. So something like you see here with the patient experience badge, we want to highlight and showcase those team members who receive those compliments, and make it fun and engaging. So not just, hey, I heard from so and so who heard from so and so that you might have been mentioned in today's leadership meeting. This is real time. They see the actual compliment. And so many people, I think, take that to heart.
Great.
Yeah. So I'll show a quick example in the feed of what this looks like. Here's Katie for today, right? Katie got a compliment from a patient's family member who wanted to share how she had made the difference. And it can be something as small as like, hey, this person helped find my brother's favorite TV show, right? Just a small moment that might make the difference for that patient, their family member, but makes a huge impact for the caregiver themselves to hear that from the folks that they're taking care of. So Katie got a compliment here. We've got Reba cheering her on, Seth too. Being able to share these not just for that particular caregiver, but across the team and showcase their great level of care quality has been super impactful. Most of the time, when we're walking into a facility, it's, hey, I, don't want to mess up, or hey, like, is this going to only be positive, or what happens if I have a negative experience? We have found that this actually can be used as leverage for generating more and more positive messaging. So it becomes kind of a lead generator for the patient experience coordinators. If you've got a patient, you're asking them to complete something like the Daisy Award, that can be a little bit more lengthy and it's not as timely, certainly still meaningful. But for that patient experience coordinator, it also gives them a really great platform to approach that patient or their family member and ask if their review would like to be public. So we found it's a great feedback loop where the team is recognized, the team is able to recognize, and it becomes a new positive interaction for the facility itself.
Great. I love it. It's one of my agree, one of my favorites. These two are my favorites of the Gratia games. They're all good. But this one is a great way to, like you said, get that compliment and that recognition real time because oftentimes you're right, it is delayed if you have to wait for a discharge survey to go out or to come through the Daisy Award. And one thing I do want to add to that is we complement existing mechanisms and approaches to
Capturing
gather that feedback and to recognize. So it isn't a
one or
one
the other.
one one or the other. Thank you. It's definitely both, and so continuing those existing channels. And this one is great. So this one is where the recognition is definitely fueled by engagement. I feel like when we roll this out at one of our hospitals are always, it's viral and
Yes.
it catches on very quickly. And then the gamification around it. So the more compliments that you get, you can earn badges and points and turn those points into rewards for monetary or experience rewards. So it's really, really cool.
Yeah, and I mean, look at the impact that they're stating on patient care. 93% saying that this helped them deliver better care. So, talking what you harkened back to, talking about burnout and what impact of that turnover and kind of the challenge around retention when you have team members who are so burnout, what a difference it makes to hear directly from your patient or even to have your coworker say, "Hey, thank you for having my back there." And building that team camaraderie in a public space, like shout outs for that particular hospital, makes an incredible difference.
Yeah, it's definitely rewarding. This one also, a lot of the managers and leaders that we have spoken with have really enjoyed this because if I'm a manager primarily on the day shift, to be able to see compliments from my night that my night shift team has received that I, may not always have visibility into is huge. And then I can, catch somebody at the end of their shift and also, add to that recognition. As real time to receiving a compliment. So,
Absolutely.
um, yeah, this is really great. Love this. Good. Patient compliments, the compliment circle and Care IQ can be applied in different settings, different units. And so, any of the hospitals that we partner with and roll these out, work on making it work for that specific unit or hospital to achieve these same type of results. So it's really, really exciting. Great. Perfect. Well, lastly, just to kind of wrap this up again, why we feel so strongly about why Gratia works. And how this approach is different is again, Gratia has the ability to tap into that intrinsic motivation of an individual staff member. With our game mechanics, we're able to boost the purpose and the progress and pride that the team members feel. We really want to make recognition in real time and visible to peers and to leadership, and recognition that really matters. Positive recognition really is what fuels engagement. And behaviors become data. And so it's not just a platform for the frontline staff to, see their progress and earn points in games. That data is fed back to in real time managers and leadership to also be able to demonstrate all of the success that a unit is delivering or at a hospital level, and being able to capture all of that. And all of these games can be strategically aligned to reinforce, again, hospital-wide initiatives that really make a difference on all of the performance indicators and to show a return on investment. Because our workforce is needed and where we need to invest right now. And we're happy to partner with any hospital that is looking at some of these initiatives. So, Melissa, thank you. And if anyone wants to reach out to us to have more questions, feel free to scan the QR code. We're excited to partner with hospitals around care quality and patient experience and to highlight these games today. So thanks, Melissa.
Yeah, thanks for having me. And yeah, excited to talk to y'all about these games and what kind of impact we can have with you too.
Sounds great.